Hi viewers, I'm Dr. Azhar and you're watching Dr. Azhar Hussain official YouTube channel. Today our topic is low sex drive in women. Women's sexual desire naturally fluctuate over the years. Highs and lows commonly coincide with the beginning or end of a relationship or with major life changes such as pregnancy, menopause or illness. Some medications used for mood disorder also can cause low sex drive in women. If your lack of interest in sex continues or return and causes personal stress, anxiety, personal distress, you may have a condition called hypoactive sexual desire disorder. If your lack of interest in sex continues or return and causes personal distress, you have a many condition called hypoactive sexual desire disorder. In short, HSDD. But you don't have to meet this medical condition to seek help. If you are bothered by a low sex drive or decreased sex drive, there are lifestyle changes and sexual techniques that may put you in the mood more often. Some medication may offer promise as well. Causes of low sex drive in women's desire for sex is based on a complex interaction of many things affecting intimacy, including physical and emotional well being, experiences, beliefs, lifestyle, and your current relationship. Some physical causes like physical change and medications can cause a low sex drive, including sexual problems, medical diseases, medications, lifestyle habits, surgery, fatigue, hormonal changes, menopause, pregnancy, and breastfeeding. Some more psychological causes like mental health problem such as anxiety or depression, stress such as financial stress or work stress, poor body image, low self-esteem, history of physical or sexual abuse, previous negative sexual experiences. Some relationship issues may be involved in like lack of connection with your partner, unresolved conflicts or fights, poor communication of sexual needs and preferences, trust issues. Symptoms of low sex drive in women. Symptoms of low sex drive in women include having no interest in any type of sexual activity, including masturbation, never or only seldom having sexual fantasies, or thoughts being concerned by your lack of sexual activity or fantasies. A very good and useful solution to this problem is found in the homeopathic way of treatment. You can use them after consulting any homeopathic doctor nearby. in which remedies: number 1 CPR, number 2 Agnus Costus, number 3 Onosmodium, number 4 Staphy Sigeria, each one in 30 potencies. Mix them all and mix 5 drops in water and use thrice a day after meal. Also, Damiana Kyau 15 drops in little water thrice daily after meal. Now you are using 3 to 4 months these all kind of medicines, and then consult again your homeopath. Be take care yourself. Nice to meet you and see you again in any kind of video. Goodbye.